Tuesday, actually. I almost said Monday. Can you believe that? It's Tuesday, March 17th, 2020, and we're still dealing with the coronavirus epidemic, actually the pandemic at this point, right? And today I am so excited, guys, because we have someone here who is going to help us talk about how we manage stress during social distancing. I spent the last 5 days really emphasizing to everyone how much we need to decrease our exposure and thus decrease spread of coronavirus. And indeed, I have Dr. Olden today, and he is going to help with all of that. Now, the first things first is I'm just going to give everyone a little bit of time to join us and really just spread the message, right? Let people know that we're on live. And that today we're talking all about how we can cope with stress. So I see people coming on, and we'll just give people a little bit more time to join us all before we get started. So 2 more people joined, and then I am going to share this real quick so that everyone can be on the same page. Alrighty, here we go. Alrighty, so guys, today we have as our special guest Dr. Olden, MD, FACP. He's a board-certified internal medicine physician, medical acupuncturist, and a registered yoga teacher. So who better to teach us all about managing stress during this time? Dr. Olden is joining us from Rochester, New York. He was named one of Rochester's 40 under 40 by Rochester Business Journal in 2017. For those who know my link to Rochester, as you can imagine, I've known Dr. Olden for quite some time now because I went to medical school in upstate New York. So without further ado, guys, join me in welcoming Dr. Olden to the live. Welcome,
Hi,
Dr.
everybody.
Olden.
Hey, Cindy,
Hi.
Thanks for having me.
Thank you for making the time to join us. I'm so excited to have you on. This pandemic is stressing people out. Social distancing, we're all emphasizing and encouraging it, but the truth is we also know that it takes a toll on a person. And so I'm really happy that you had the time and that you're able to join us. I see someone saying they're unable to see or hear. Now, when I look at my app, I can see and hear us. So I think the person who's saying they can't hear will need to refresh their feed because it's working well. In terms of, again, sorry, I was just responding to that person, but welcome and thank you so much for making the time. How are you doing? You're in upstate New York, right? You're in Rochester?
Yeah, doing good. Unfortunately, yes, we are all kind of suffering from the different vibrations from this pandemic. There are many businesses that are, shutting their doors, restaurants, bars, as it's happening all throughout the country. Where I live is actually about 5 hours north of New York City, so we're not really right in the center of things, but we are starting to see cases here. We've already got a few in Monroe County, actually.
Wow. And Monroe County is encompassing Rochester, New York, and the environs, which include some of the other cities in the area. Can you tell us more about Monroe County?
Yeah, it's a great place to live. We're the home of Genesee Brewery and the University of Rochester, where you and I both trained. It's a great place to live. That's right. Great quality of life up here. It's a place where people love to be outside. Got lots of great hiking to do here, and Finger Lakes are nearby. So if you like wine, this is the place to be.
Yes,
yeah. So
we started a few wine tours together.
That's right. Yep. Exactly.
Yes, and people may think we're just making small talk, but part of the reason why I asked you that is because this is a great time to go out and explore, and I'm sure you'll explain that some more as to how that helps people as we go through social distancing and dealing with being mindful during this time. And that kind of brings me to my next question, which is tell us a little bit more about what you do. First it says you're board certified internist, meaning you're a physician, but medical acupuncturist, yoga teacher, mindfulness practitioner is a pretty big extra set of work, I would imagine. So what got you into this and how do you apply it day to day?
Yeah, that's a great question. I spent about 10 years of my career treating patients with severe illness, both managing them in the hospital, so people in ICUs and people, who are really critically ill. That's the core of internal medicine. I then from that went on a path to do palliative care and a little bit of hospice as well. So at one point, over the last couple of years, I thought, I think it's really what is the next stage of my career going to look like? What do I want to kind of do to leave my stamp on things? And yoga and acupuncture are two things that for me really helped me through anxiety, depression, and the stress really that we all encounter in our day-to-day work. So I thought, well,
Yeah.
why not see if I can put the two of these together? And that's where the idea of mindful medicine came, is let's try to bring things back to being a bit holistic. Let's look at what is the root of the problem that we're experiencing instead of covering up a blood pressure with a medication, right? Like, how about if we talk about diet and exercise, and let's just bring a little bit of mindfulness to what we're doing. And I think, Cindy, you and I can both agree that this isn't about the physicians, about our colleagues not doing a good job. It's a system problem.
Yes.
And the way that, right, so the way that our system is set up for 10 or 15-minute visits, if we're lucky, seeing 20 or 30 patients a day, and then spending a few hours at night documenting, there's just really not a lot of time in the system built in for us to spend the time with patients that we want to spend.
It's true. And I think most patients aren't aware of that, which is doctors are now put on so many time constraints that we many times want to ask about the emotional questions, the day-to-day activities, and how is life affecting your health, but we don't really have that time. And so I'm glad that you decided, you know what, I want to put all of this together. So how did you go about getting certified and really putting together a program?
Yeah, great question. So I, as I mentioned, I was a bit familiar with acupuncture because that's something that I received myself, and it really helped me to deal with anxiety. One of the other things about my job was in palliative care. I spent a lot of my time writing opioids, and so with this whole opioid epidemic, I thought I want to be a little bit more responsible about what I'm doing.
Yes.
And is there a way that I can treat and manage pain without just piling on the medications?
Yes.
So to keep it simple, I enrolled in an acupuncture training program for physicians. You wouldn't believe how many physicians I met during that training that would say, this is what's really going to save my career. This is going to allow me to spend more time with my patients. This is going to allow me to treat conditions by getting to the holistic, nature of the person instead of another prescription.
Yes.
So it really just happened kind of organically and naturally. And at one point I had to just say, look, I'm going to quit my job. I'm going to open this practice and kind of put it out in there, put it out to the universe that this is what I have to offer.
And I think what you've done has been terrific. And I know you're seeing some amazing results with your patients, which is proof that this is necessary. And for those who are listening, because some people may not be familiar with the term palliative care, so they can really understand your background, in the context of being a hospice doctor and a palliative care doctor, what was your day-to-day like there? What were your patients like? What was happening in that setting?
Yeah, so most of my patients that I would meet would be really sick with many chronic conditions. Patients with cancer, patients with chronic obstructive lung disease or emphysema, patients with an end-stage neurologic disease like Lou Gehrig's disease, for example. Patients who really have limited options. But with palliative care, these are people who want to focus on living as good as they can for as long as possible, right? And they want to minimize interventions that may not help them improve, that may not really improve their quality of life.
Yes.
But unfortunately, you know, a lot of what we have to offer is symptom relief. Is, I should say, is limited to symptom relief, right? So the focus for folks on palliative care may still be curative. Folks may still be getting chemotherapy. They may still be getting disease-directed therapy like dialysis, but for the most part, the focus is going to be on symptom management.
Yes. So symptom management to make them as comfortable as possible, really.
Mm-hmm.
And so that can take a toll, not just on patients, but on the doctor, because sometimes you lose sight of the human involved if you're treating
Yeah,
symptoms.
absolutely. Well, I think what ends up happening is, you know, despite our best efforts and as much as we really want to have time with our patients and have time to talk about family and what's important to them, it's on to the next, and it just kind of perpetuates this unfortunate cycle. So what I think palliative care offers that some of the other specialties don't is time. I mean, we would spend an hour and a half with patients and their families. We were really blessed with the time that we needed to have some really difficult conversations. So I'm kind of,
conversations to have there.
Absolutely. And that's what really led me into this career path, which again allows me the time that I want to spend with patients. Most of my visits are an hour and a half for a new person. So I'm really getting to know them, and not just their medical problems, but them as a person. The whole biopsychosocial model that, you know, we learned here at Rochester.
Yes. And Rochester, I mean, I can't stop giving Rochester props. Whenever people talk about how amazing a physician I am, or how I seem to be so easy with patients and calm, and I seem to touch on everything that's addressing them, not just the specific medical condition that they wrote on the paper. And I give credit to Rochester and the training and that emphasis on biopsychosocial, meaning the body is linked to the psychological side of the human, as well as what's going on in their general life, the social, and recognizing that it all goes together to make the disease and the healing, the response, they go together. And so I'm really, really happy that we can talk about this, because especially in this time of coronavirus, where we don't even know what the most effective treatments are. A lot of what we have to do right now is support the human, support those who are caretakers, caregivers, and give them tools for coping with the stress of the possibility that they may get infected with something. A lot of my listeners have underlying chronic health conditions that make them high risk for potential COVID-19. And so I know for a lot of them, they're stressing out. You know, it's not just about being at home, but what if I do have it? What do I do? You know, on Sunday, we talked about preparing your family if you had to be hospitalized, or how would you cope if, as a single parent, you had to go to the hospital and your child had to stay at home. And so that's the kind of stuff I'm hoping we can talk about. And it sort of leads me into one question that I had for you, which is, what does happen to the human body when someone is stressed, when someone's anxious and thinking about all these things that could potentially happen from coronavirus?
Yeah, so I hope that your audience might indulge the both of us in a little discussion of the nervous system, which I think is important for us to think about every day, but it's something that we at many times take for granted. So we have this underlying nervous system in our body. It's called the autonomic nervous system. And it has these two different sides. I like to think of them as like the yin and the yang.
Yeah.
And it's the sympathetic is the fight or flight system that goes into effect when we are encountered with something frightening or scary or fearful. And it's a good response actually for our body, because it prepares us for battle, right? So if we're being chased by a bear, our heart rate increases, right? Like our pupils change size, and the blood rushes away from our intestines, because we don't need to be digesting food. We need that blood to be in our heart and our lungs.
We need to get away from that bear.
Exactly. Yeah. And then the flip side of that is, so we just talked about the parasympathetic, and now the flip side of that we just talked about the sympathetic. Now we're talking about the parasympathetic, which is the balance. And, you know, that's the system that's often thought of as rest and digest. So we're walking around, you know, most of the day trying to keep a good balance between those two. And unfortunately, in conditions of stress, in conditions of chronic stress, that sympathetic system is in overdrive. It's too active. And the effects of that on our body, we could do a whole separate webcast on that, but they lead to chronic disease. Chronic stress leads to chronic disease, and we need to find a way of finding a good balance to those two.
And what are some of those sort of sympathetic nervous system symptoms that manifest during stress? Like, what might someone be feeling that, as we call them, psychosomatic symptoms? What might that be?
Mm-hmm. Yeah, I mean, I think it's what I like to ask my patients a lot of times is that, I will actually ask them, what does it feel like for you? Like when you tell me that you're anxious, what does that feel like to you? Does that mean your heart's racing? Does that mean that you need to withdraw? Does that mean that you need to go and take a nap? What is it? Is your stomach sink? Do your bowels become irregular? The effects can be different on each of us, even though our bodies have similar setup. We're all affected by anxiety and by stress in different ways. But I would say if you're talking just specifically about the nervous system, right? So our heart rate's going to go up, and our blood pressure, our blood pressure increases because we do this. Yeah.
You're right. Yeah, because I think it's important for everyone listening to hear this, which is stress and the signs and symptoms of stress can be different in different people. So, some people, like you said, they may have the runs, their bowels get very gurgly and suddenly they have diarrhea, the heart racing, the panic attack that we hear about, that sense of doom, or the shortness of breath that came out of nowhere. And I think it's important for us to know this, given some of those symptoms are also what we've been telling people are signs and symptoms of coronavirus infection.
That's a great point.
Shortness of breath, possible nausea, possible vomiting, heart racing, not so much, but definitely shortness of breath, etc. And so I think some people, as you get anxious, or what people would call hypochondrosis, it might start thinking, oh my God, is this a symptom? Am I having coronavirus? And that's your whole stress level rising as well. And so I think it's important to know yourself, know what might be your signs and symptoms of a stress attack or a panic attack or activation of your sympathetic nervous system. So that's really helpful. And same goes for children and being mindful of that within your family.
And I would say, Cindy, I'm really glad that you mentioned that, because I did another one of these lives this morning, although I think it was my first one and I maybe just was talking to myself the whole time. But we're going to get better at these.
Yes.
One of the symptoms, if you look at the different criteria for making a diagnosis, they list on there gastrointestinal 10%.
Yeah, for COVID-19, right?
For COVID, yeah. And so I'm thinking to myself, well, many people, when they get sick, they get anxious, and they end up having, I would imagine that maybe 10% of us are anxious, and 10% of us are going to have any GI symptoms when we get sick.
Yeah.
So if you latch onto that symptom, and you're an anxious person, and you automatically start thinking, well, now I'm sick, I've got some kind of gastrointestinal disturbance, it just snowballs. And so I think, what we'll talk about at some point, together tonight, is how do we manage that?
How do you manage that? Because that's going to be important. It's going to be important. And, so we talked about the nervous system. What other systems might be affected during stress?
Yeah, that's a great question. I mean, I think let's talk about the immune system, for example. I mean, that's a very pertinent one. So I just want to mention a book that I found really helpful when talking about stress in our body. It's called Why Zebras Don't Get Ulcers, and it's kind of an interesting book. Both Cindy and I are not getting any money from plugging this book, and in fact,
we don't even know the people who put it together.
Yeah, it's a pretty dense book. But what they talk about is, going back to this whole stress response. Animals and zebras, for example, when they get scared, they get this sympathetic fight or flight response, and then they go back down.
Yeah.
And they're able to bring themselves back to homeostasis, back to normal. But these days, especially with what's happening with the coronavirus, there's no escape to this stress response.
Yeah.
So we're getting text messages, we're seeing a news update, the president's on television, there's all these things are happening. We get stuck in traffic. And I'm even talking about just before the coronavirus happened, not to mention now.
Not to mention now, indeed.
But the problem that, so these animals have this response, they go right back down to normal, but we are spending way too much time in this stress response.
We're getting wiped in stress.
Exactly. And so what they talk about in this book is that the body is, we want our bodies when we become stressed to become stronger, to the immune response to improve, right? Because if we're stressed, we want our bodies to do the job for us. But if you look at the graph, if you look at what happens, if, in the short term, yes, the immune system responds and it becomes stronger. But in situations of chronic stress, our immune system weakens.
Yes. Yes.
And this is research that goes back, tens and tens of years. So I think, when you ask, what other symptoms are affected, I mean, right now, what we're going through right now, thinking about the immune system is even more reason why we need to be helping ourselves to get stress back down to controlled levels.
Indeed. I think that's super important because I further just want to reiterate what Dr. Olden is saying, which is true. A chronically stressed person's immune system weakens, and it's for a variety of reasons, but there's an interplay between hormones, your immune system, hormones, your fight or flight response, hormones, and sleep. And of course, if all of those things start becoming disordered or irregular, then all stop working the way they're supposed to. It's why, for example, if someone's really in a stressful job even, or being bullied at work, we know their immune system weakens as a response to all of that stress and bullying, even at work. They're more prone to infections and illnesses because they're stressed. And so that, again, you're right. That's why we're going to talk now about how we affect and change stress levels and impact it so that we can spare ourselves the potential worsening of even our immune response to any infection, but even COVID-19. I think the first thing we should talk about, though, before we define that is what do we know about social distancing? Meaning, if you have to go in isolation, quarantine, for people who are in prison, the ones who are put in solitary isolation, how does that affect stress levels?
Well, I think even not to mention, I was speaking to a colleague of mine today who's a nurse at one of our hospitals, and folks who are hospitalized, at this point, the hospitals are closed to visitors.
Yeah.
So with the exception of, I believe, childbirth and hospice and children, visitors are not allowed.
Yeah.
So, Matt, we're here, you and I are talking and we're connecting and, we're able to walk outside for a few minutes, but these individuals are very sick and they're not even afforded the luxury of one-on-one, touch or even communication with family and friends. Yes. So they're being socially, in a way, social isolation. Yeah.
And that's true. And that leads to more stress because we actually need that interaction. And humans, we need touch more than we realize. And so at the same time, we're trying to balance that with preventing the exposure to coronavirus, recognizing that we don't have effective treatments. Our hospitals are reaching capacity, and it's also flu season. So we have other illnesses and chronic illnesses that require hospitalization as well that we're looking to deal with. And so that can further affect stress levels, even if someone wasn't stressed out before.
Oh yeah, absolutely. Absolutely. I mean, I think it's a real problem. And, if we start talking about like, what are some of the symptoms that folks can suffer from, or what happens with this social distancing, it's pretty similar to what people feel like when they're depressed. Changes in appetite, not wanting to eat or wanting to eat more than what we normally eat.
Right.
Disordered sleep patterns. So, like just taking naps through the day, but I can't sleep all night because I'm thinking about this, or I've got the news on, or I watched the news right before I went to bed, which is always a bad idea, right?
Yes, I agree. I don't even have a TV in my bedroom on purpose.
Yeah, exactly. I hope you're putting your phone down though too, Cindy.
I actually put it on the nightstand now.
Okay.
Especially when I was taking call, I would have the phone on the bed, which meant I would keep it playing and fall asleep. And it's true, I found that if I fell asleep with something playing, it keeps me from sleeping deeply. I'd even just dream the dialogue that's going on in playing. So I stopped that.
Yeah. Yeah. So, so as I was kind of looking into this, and I'll share, some resources afterwards with folks. But again, the symptoms that folks feel from social distancing are very similar to what one might feel when they're depressed. And again, it's low energy, it's disordered sleep patterns. That's why it's going to be so important for us to take care of our bodies during this time.
I agree. And so, speaking of that, what are some of those strategies that we can use to deal with stress and stressful times? And then, of course, guys, I will bring your questions on so that Dr. Olden can address them specifically, because we have a lot of very engaged viewers here tonight. But yes, in terms of some of those things you were alluding to, what sort of specific things can people do to help decrease stress in the short term while driving, at work, or if they're stuck at home, on isolation or quarantine?
Right. So I think it's important for us to be educated, right? So watching the updates and watching the news and being up to date with what the guidelines are, we do need that. But there's kind of a line that we need to draw between what's helping us and what's hurting us and what's too much. So limiting exposure is going to be huge.
Yes.
I find it helpful to only allow myself, the morning news updates and then update at night, because I could easily spend my entire day looking at the graph and following the numbers and what's happening in Italy and is it happening here. And, I'm kind of we're both scientific people, so we want to follow this. And
easily, it's true.
Yeah. So I think that's probably one of the most important things, is limiting our exposure to the bad news, right? Yeah. On the other hand, I think it's also helpful to educate ourselves in a healthy way. I can tell you that for me, even being aware of what's happening and being able to have some scientific knowledge of what's happening is helpful, because I feel a little bit armed with information now.
Yes.
So that's why I say go to the trusted sources. Right? Go to the CDC website.
I'd love for you to repeat that. Where should they go for information?
Exactly. Go to the CDC website or go to the World Health Organization. You want to go to a trusted, vetted organization, because if you're finding your news updates on Instagram or Facebook or Reddit or somewhere else, right? We don't know where that information is coming from.
Yes, I mean, that's sources, i.e. here.
Yes. Yes, exactly.
But you're right. Be aware of where you're getting that information.
Mm-hmm. Yeah. So, Cindy, and one of the things that you had up on one of the previous slides, or the previous bars down here, was how can mindfulness help? And I think I would like to just take a moment, because I'm representing my business here, Mindful Medicine Rochester.
Yeah.
Please do follow me on Instagram. I post a lot there. But what is mindfulness? And I find when we're having a discussion like this, it's always helpful to get ourselves on the same page. What are we talking about? So what is mindfulness? And I like to go back to a definition that was put out by John Kabat-Zinn, kind of a famous leader in mindfulness. And it's really a simple definition. If you think of being mindful, it means paying attention in the present moment without judgment to our surroundings, to what we're feeling. So and it's purposeful. So we have a purpose when we're doing it. Our purpose is to bring ourselves back down to a state of being calm. Some might say when's the last, You probably remember a time when you called a friend or something and said, I need you to bring me back down to earth.
Yes.
Like, am I going crazy here? Right? That's how we bring ourselves back. So it's paying attention on purpose in the present moment without judgment. What does the without judgment mean? It just basically means when those thoughts start swirling, or we start going into this snowball panic, it means
you start harming with your own negative thoughts. Yes.
Right. It means let's be gentle with myself. These are thoughts. These aren't me, right? Yeah.
So do you have any examples maybe that we can do right now in this moment, a short mindfulness exercise that we could do along with the viewers to show how mindfulness, how you could purposefully bring yourself back down and reset?
Yeah, absolutely. So, let's just take maybe a couple of minutes here. All right. I don't know, Cindy, is it possible for us to see like how many people are with us right now?
Yes, right now we have 54 people with us.
Excellent. So that's 54 people that are going to leave this conversation feeling even lighter than they did when they came in.
Yes.
So mindfulness and meditation are similar, but not the same thing. A meditation could be following a candle for a few minutes, just looking at the flame, or it could be bringing our focus to our breath, or it could be going for a walk. It could be a walking meditation. There's many different ways to meditate. But a mindfulness meditation goes back to that, just paying attention and without judgment. So I'll just invite those that are with us here to find a comfortable space where you're sitting. I hope you're not standing on a subway hugging a bar somewhere. I hope you're at home, cozied up. And if you're able to, feel free to close your eyes or even just look down, a few inches in front of you as I just lead us through this quick exercise. So I'll invite you as we rest here to just bring your awareness to the sounds that you hear in the room around you. And maybe you're directed to some cars driving by outside or a dog barking, but just bring your focus to those sounds. And as we do this, just see if you can relax the muscles in your face. Maybe scan your body. Are your hands clenched? Can you let those relax? And start to draw the attention to sounds that maybe are a little bit closer. So it could be, for me, it's the fan on my computer. And you know that as you're going through this process, thoughts are going to come up in your head, like I have to go out and grab some groceries, or I have this errand to do, and you just allow those thoughts to come. You are not judgmental with yourself that those thoughts came up, because it's happening for all of us. And you just let them go and you come back to observing. And now we're going to draw our attention even more internal to our breath. So you might be hearing those sounds outside or sounds in the room, but you're just focusing right now on where you feel the breath in your body. For me, I'm feeling it coming in through my nose and out through the nose. Some people feel it in their chest or their belly. You might hear those sounds again outside of you, but just bring yourself back to the breath. How about focusing on the temperature of your breath? So it kind of feels, for me, it feels cool when I breathe in through my nose, and it feels warm when I breathe out. And so this practice involves just bringing a bit more awareness to our bodies, trying to unite our body and our mind, bringing a little bit more peace to our bodies, slowing down a little bit, letting ourselves come into that balanced parasympathetic mode. And so we'll close by just taking a couple of deep breaths in together. So let's all just take a deep breath in through the nose and breathe it out. And do once more. We'll breathe in through our nose and breathe out. So just gently allow the eyes to open. Just bring your gaze back down. And then we'll come back to peace.
That was good, indeed. And I felt that. I hope other people listening were able to experience that, because that was a brief mindfulness exercise that worked. I feel relaxed even in my arm muscles.
You're having acupuncture as well.
Yeah, I'd actually been holding my hands as we started. And so in that moment when you said release, unclench, I felt that relaxation happen. I felt it. That was good.
It's a really powerful exercise, and it's one that you can do at home and you don't need any fancy equipment for, right? Again, I'm just going to bring it back again to the biopsychosocial model. Our mind has so much to do with our body, and we really do ourselves a service when we try to unite those things together.
Mm-hmm. And that's true, and it's important to do that unification. Now, what about the person? Sorry, there's someone who's texting me.
Thank God that didn't happen during our meditation exercise.
Oh, what about the person who's listening who says, I just tried that. That did not work for me.
Excellent question.
Kind of stuff works. What do you say to that person who is interested but doesn't believe it'll work?
Yeah. So I guess I would say two things. I didn't think it would work, and it really helped me. But we're both scientists. We would say the N of one, right? So just one person doesn't mean it applies to everybody. Everybody's different. Mm-hmm. So it doesn't have to be what we just did. Mm-hmm. What is it that recharges you? We're all different. Some people like to run. Some people like to do yoga. I'm an advocate of just getting outside and breathing in some fresh air. I think I made a post a couple of days ago about the pandemic in 1918 and how many of the soldiers were being treated outside in tents. And they took some of the soldiers out, and put them in the sun. And they researched this, and they actually found that this improved outcomes. Mm-hmm. We don't really know why. We're not saying that the sun killed the virus or any of that, but I think it just goes to just points out that nature does the body good.
It does. And the sun, I think, I joke all the time to people that I'm a sun person, right? And so I feel more alive, more myself when I'm in the sun or in a warmer climate that's sunny. And I say that as someone who lived in Rochester for 8 years with the so-called gray winters of Rochester. But I agree with you. So tell people more about how to use the sun to help de-stress as well. Because I know in my own office, if I have a staff member who's struggling with something, I may tell them, why don't you take 10 minutes, go outside, cool down, come back in, or really go outside, get a quick hit of sun. It's like getting a hit with the sun and come back in. But how do you use the sun with your patients?
I don't know, Cindy. That's a great question. I mean, unfortunately, I think as you're aware, here in Rochester, we don't get to see the sun that often. So, yeah, to tell someone to go spend 10 minutes outside could actually be bad advice in some cases here. But I think it really is just looking at what's that individual that benefit from most in their personal life. So I know there are many apps out there that are offering their services for free for the next few months. So there's a yoga app, there's a high intensity interval training app. I can, put all that stuff into the feed later. But but they're free services. So you can be doing yoga at home. You could, if that works for you, you could be meditating at home. What about thinking about something that you've always wanted to do? Like, I've always wanted to be able to do a handstand, right? So I've been like working on that. What about setting a task for yourself that you wanted to complete and drawing your focus and your attention to that instead of the next news update?
So that's a mindful way of taking your attention away from the thing that's stressing you, which is the news.
Exactly. Yeah. Yeah. And again, using what resources you have in your house, because we are all trying to spend as much time as we can in, I hate to say isolation. It's really more distancing, but it feels like isolation.
It does. For many people, it does. And certainly, I was talking to one friend last night who pointed out that for a lot of us, we don't really live close to family anymore. The world is such that people are spread far, particularly young people and millennials and so forth. They're spread away from their family, which goes in two ways. So it means they're elder family members who may be considered more high risk, or ill family members who are more high risk for COVID-19 are away from them, but they're also away from their family. And this person was pointing out that they were at home alone on self-imposed isolation. And it was very striking to hear that, because it's true. So many of us are separated from family.
Yeah, and so I think it's what a great, so I was talking with a friend of mine who is a yoga teacher here in town last night, and I'm glad that she said this, because I did have this thought to myself again, bringing it back to the yin and the yang. What are the positives that we can take out of this situation? It really is an awful situation. It's something that we are all experiencing at the same time, right? But we're experiencing it in different ways. Like my experience of it in New York and as a holistic doctor is different than your experience of it, and my experience is different than my client's experience. We're all feeling it in different ways.
Yes.
Right. So it's important to remember that, and to be gentle with ourselves when we feel anger because our event was canceled, or sadness because our restaurant can't get our favorite. For me, it's Starbucks, actually. But I'm looking at it as a positive. I've been wanting to decrease how much Starbucks I drink. So I'm trying, it's like reframing that situation. But yeah.
And that reframing is important. I think a lot of people think that reframing has a negative connotation to it. And some people will describe it as being, in the case of the people who look at things as glass half full, you're too optimistic. But I feel, in my personal belief, reframing is necessary a lot, because it's how you look at things. Many times it determines how you react, and it determines how you ultimately treat your own self in the face of adversity, is how you frame it. And so I think it's important to consider that. We have some questions. I have some questions for you too, but I also want our audience to feel like they're a part of this. And so one person, this is more of a comment, CC Earthly says, thank you.
Hi, CC.
I need. You're welcome, CC. I think so. I agree. A lot of us need to hear this. It's not always just about how bad coronavirus is, but it's also about how do we cope in the face of what we're hearing. And so we have another comment that says, good night, Doc. Thanks for the information. Grateful. We have someone just greeting us again. Anne Marie says, good night, Dr. Cindy, and your guest, Dr. Olden.
Good to be here.
Yes. So guys, I'm scrolling through looking for questions, and this is good. What we have here are some comments, so we'll get the comments soon. Good evening, Dr. Duke and guests. Thank you so much for this timely live. It is very informative and hands-on. So let me ask you this. Let's imagine someone ventured their way out to the supermarket, and the lines are long. Things are getting stressful. They've heard everyone tell them you need 2 meters, 6 feet minimum between you and the next person while you're outdoors. and they have no more food at home. So they're stuck, they really need to get food, or they need to get that pharmacy supply, but they're also starting to panic that maybe people are too close. What would you recommend in that situation? How to cope?
Mm-hmm. Yeah, that's a really great question. I mean, I think it's possible that any of us could find ourselves in a similar scenario. I mean, I know I was just asking my partner tonight, what's our meat situation? I mean, I never thought I was going to ask a question like that, but how much chicken do we have left in the fridge? And is it better for us to just eat what we have in the house instead of going out and exposing ourselves to whatever might be in the supermarket?
Yeah.
So I guess I go back to the thought that I had before, which is, when we're faced with a situation where we're anxious or stressed out, focusing on the things that we have control over. Because the things that we don't have control over are often the ones that really get us ramped up, and really get us feeling anxious. So what are the things I can control? Well, I'm gonna go to the grocery store at a time when I know it's not going to be that busy, or I actually have 10 minutes where I can actually just step away from all of these people and spend 5 minutes and just do some breathing to bring myself back down, because it's not going to do me any service to get ramped up when I'm waiting in line for the chicken to get refilled, because that's really what's happening these days. Maybe it's going to be best. I mean, I know for me, like if I have music on when I go into a store, it's a less stressful experience for me, and the commotion of everyone around me. So sometimes maybe just you can control what you hear. What about just putting in some music that is going to be soothing to you, or possibly re-listening to this podcast or this presentation, right?
I agree, and I think that's important. Have something to listen to so that you're somewhat disconnected. I mean, make sure you're safe. We're talking about being in a store, not crossing the street here, but that's good. Have something to listen to.
Mm-hmm.
Yeah,
I mean, folks who
it's
right. Yeah, I mean, folks that are anxious do good with plans.
Yeah.
So if you know that you're going to go into a situation that is going to stress you out or make you anxious, try to remove the unknowns as much as you can.
Yes.
Right. And you may need to run that scenario before you go. It's just like, well, who's going to be at that party? Who do I have to talk to? Who's that person? It's like figuring out your plan before a party for introverts.
Yes.
Same thing applies for this particular situation. Is
you're out shopping and it's stressful. It's going to be pandemonium because you've seen the news. Prepare.
But bring it just back to some of the basics too. The basic hand washing, right? If you're going to go out to the store, don't buy a muffin and eat it when you're waiting in line.
Right.
That's probably good advice, right? Or wait to open. That's right. Exactly. Exactly. Yeah. So just following the normal hygiene and protocol that's been put into place for us.
Very practical things that people lose sight of and thought of in an anxious or anxiety-inducing situation. So that's good.
Cindy, I have a question for you. Oh, let's take this question.
Okay. So Joanne says, I'm thinking of taking a drive tomorrow. I'm indoors since Friday night, already getting very anxious. What do you think?
So I'm going to assume that the person is anxious about leaving the house, right? Maybe about just going out into sort of the world where there are a lot of unknowns. And so I think I would say that, again, have a plan and think about how you're going to structure this so that it works for you. Bring items that are going to make you feel comfortable. Make sure if you're going to take a drive, just make sure you don't need to stop for food. Bring your own food, right? And maybe bring some things with you, like a warm washcloth or something, so you don't have to use a public, you don't have to wash your hands somewhere. Bring sanitizer, that sort of thing. Set some music up that's going to be calming to you. Bring foods that you like, things that you can look forward to.
Yes.
Yeah. This is a time, I think, for us to also remember, like, as I said before, thinking of the good and the bad and being a little bit positive about this. Think about the opportunities that this offers us. At what other time in our life do you think that we could go outside right now or wherever you are, and there's going to be very little air traffic, and looking up, and you can look at the sky with like hardly any planes.
Yeah.
And it's going to be quiet because there's not a lot of people driving. So I look at that almost as an opportunity, right? And me walking out into my backyard is not putting me at risk.
Yes.
So these are just some thoughts, but I think allow yourself the permission to be anxious about it. It's going to be anxious to go outside and to drive, but what are the things that you can do to control that situation?
Because, that's especially true for the person who perhaps is watching and has heard what the risk factors are. And so now they're scared that they have these risk factors. Maybe they have underlying lung disease, the emphysema patient, the chronic smoker with a chronic cough, the chemotherapy patient, or the patient on the transplant, the organ transplant patient who knows they're on chronic immunosuppression. And so what we're saying is with social distancing, it doesn't mean you literally have to stay locked indoors. It means, like you said, planning, preparation, and that maintaining distance, but also still getting outside, even if it's sitting on a balcony, getting to sit outdoors.
Cindy, what do you think about ordering takeout?
I actually recommend it if you can be sure that, that they're following usual protocols. I think one of the things I've seen and felt reassured by is that the majority of restaurants that I've seen advertised, they're highlighting how many precautions they're taking within the kitchen, within how they pack food, etc. I know some people are scared because the viral particles can exist on cardboard or plastic for a little bit longer than, say, on a soft cloth surface, for example. But what I tell people is, you can have delivery, you unbox it, you bring it inside, then you wash your hands, and then you start, doing what you have to do. So I'm not against delivery, takeout, but if you can prepare your own food, I actually tell people to prepare their food always, but that's for more general health reasons, because you can control your ingredients then.
Yeah, I think that's great advice. I mean, it's hard, right? Because we're trying to decide, well, I really want to support local businesses, but at the same time, I don't know who prepared the food, or if that person was exposed. And again, we can really let our minds like start going with this. So we have to bring ourselves back to reality sometimes. But I think just making smart choices.
Okay, we have a question from Kathy. Someone's messaged me saying, can you answer Kathy? So 1 second, because Kathy's message for some reason is not showing up on the stream that I'm seeing. So I'm going to go into the app here and locate Kathy's question so that I'm not ignoring the question here. And so the question that we have from Kathy, let's see. I don't see Kathy's question, so this is a little weird. But hold on, I'm going back. Yes, I got a text from someone who knows me personally who says, read Kathy's question.
Well, while you're looking for Kathy's question, I will tell those that are still with us that you'd actually be surprised at how much information is on the WHO and the CDC websites. I was just curious about what are they saying about accepting a package from Amazon.
Yes.
Right. Yeah. So, and according to them, you do exactly what you said, Cindy. You bring the package in, you unpack it. The likelihood that whatever is inside, whatever was inside wasn't touched by the individual that delivered it. So just be smart. Just wash your hands.
Yes.
If the item was food, obviously you're going to wash it before you eat it. But there's no evidence out there that we know of that the delivery of packages into the house is going to be is how the virus will be transmitted.
Absolutely. And, the other thing is, especially talking about de-stressing, for many people, their form of de-stressing has been their pets, interacting with their pets, taking their pets for a walk. But I know a lot of people have heard stories that said that pets can transmit coronavirus.
Hmm.
And that's all based actually on one story that came out of Hong Kong about a dog testing positive for COVID-19, coronavirus, not the disease, COVID-19. And so, what I would also say, speaking of the World Health Organization, is they've also demonstrated, they've shown that pets are not transmitting the virus. So, dogs can't transmit the SARS-CoV-2 virus that we're talking about in the pandemic. Now, there are people who've gone out there and found veterinary articles that have the word coronavirus in it and have now co-opted that and says,
Hmm.
oh, here's an article, dogs transmit coronavirus. But what I want to say to everyone looking is dogs can be infected by viruses too. They're dog or canine viruses, just like cats have certain viruses, etc. And so there are coronaviruses that dogs can get, but it's not this one. It's not SARS-CoV-2 that they're transmitting. My point being, it's safe to take your dog to the pet park and walk it. It's safe to walk your dog, and the
Mm-hmm.
WHO recommends that. Um, for a lot of people, their animals are their comfort animals. It's what they use to de-stress or reduce their anxiety levels. We see that with the people who bring their comfort animals on planes or need them to go outdoors and interact with other humans because they're afraid otherwise or have anxiety otherwise. And so to someone who's watching and thinking, well, not only am I socially distant from other people, I can't even really interact with my pet. Talk to your veterinarian, make sure your pet's doing okay, but you don't have to be that isolated.
Mm-hmm. Yeah, and and in the case that, God forbid, something may happen that someone is isolated, just make sure you have enough meds for your pet if your pet's on meds, or enough food, right? Just be mindful of that, so that's not something that you end up becoming preoccupied or nervous about. Well, the comments are really coming in now.
All of a sudden, I'm like, where are these comments coming from? I can't even keep up anymore. The comments are coming in, and so I'm gonna try to tag a few here because we have quite a few. Okay, now I see Kathy's messages. Hi,
Oh,
Kathy. Someone
it's Michelle and Kathy. Yes, we have the old Dewhurst crew here.
Yeah, to his crew. So Kathy Santos Alfonso is one of my PhD lab mates. Actually, we sat at the same bench. We sat next to each other. We even traveled the world going to virology conferences, making our way all the way to Switzerland. Hey, Kathy.
Wow.
So she says, what can we do to help kids manage stress? Well, Kathy, I think what's nice is a lot of what we're talking about can be applied. I actually have a pediatrician joining us tomorrow, and we're going to talk all about children and stress management and strategies for helping them cope during this time, because whether we know it or not, the kids are listening. They're watching the news we're watching. They're seeing our anxiety, and they can read the room. They're feeling our anxiety, the stress level as well. And so it's important that we help them. And so thank you. Kathy has another question. Wow, no wonder that person texted to say, listen, look at Kathy. Kathy asks, managing work and providing e-learning for kids is stressful. What do you say to that parent who is stressing out about the fact that the kids are off from school? We're not sure when they're going to go back just yet. We're not sure about their learning and development, and are they meeting their milestones? And so that parent who's just really stressing about all that, or maybe stressing about no daycare and they have to work, even if it's remotely, there may be parents who still have to work and watch the kids now that they're home. What can that parent do for themselves in that moment?
Yeah, I mean, I even wonder if just planning a time where the whole family can do a fun exercise together that's going to be naturally a de-stressing exercise, right? Like, hey guys, I just heard this app is free. Let's check it out. Let's see what they're doing. They got free yoga, or they have a free, this sort of thing, and let's experience it together. I think you're absolutely right, though, being mindful of the fact that trying to balance work and now teaching your children and babysitting, I mean, the responsibilities just seem to be continuing to pile up and not getting any easier.
Yes. Now, I happen to have another thing I can suggest is based on a patient that I saw today, a patient who's insightful. She's an art teacher at one of the local schools here in Las Vegas. And she actually went into the school today, school's out, but she was at work because she was creating online art lessons for the first graders and other students. And so now her art lessons are posted on the school's website. So based on that, I would say one of the things that seems that are happening is a lot of schools are creating some online programs and resources for families to continue to interact and find ways to entertain the kids and teach them at the same time. So, for example, this art teacher went in to take the art curriculum and put it now into an online webinar for the families. So I think that's really good to know. Um, this person is asking, Julia Brown is asking, Dr. Duke, I was asking this question today. Can someone get infected twice with the virus? So now we have some medical questions as well, Dr. Olden. And the question right now is whether or not people are going to develop long-term immunity. We don't know for sure yet. But you would think yes. And so if that's the case, then even if you were infected a second time around, your symptoms probably will not be as severe. Because having immunity doesn't mean you won't get infected again. It's more how your body responds to the virus. It's the whole premise behind vaccines, actually. I'm on a soapbox now. But most viral vaccines are actually weakened forms of the virus. And that's because of how viruses work, like we talked about on Saturday, is viruses infect cells, and then they cause the cell to make more virus and release virus, new particles. So our immune response is actually a special part of our immune response, what we call T cells, that then identify the cells that are infected with a virus and destroy those cells. And so the hope is if you've been infected once before, your special T cells then learn to recognize an infected cell, remember what an infected cell looks like. And the next time you're infected, those T cells attack before those cells can make more virus. And so the short answer is yes, I think you can be infected more than once by the same virus. But what happens differently each time is that you're able to fight it off earlier and prevent the infection from spreading to more cells in your body.
Kathy, I think it's. What do you think about this? Also, just remembering that not only are we trying to protect ourselves from the coronavirus, but the flu is still, influenza is still circulating as well.
It's circulating. So get the flu shot.
Yeah, and I mean, I think a lot of the folks who are getting really sick from the coronavirus, they have comorbidities, they have possibly other infections, other things that are happening. So again, it's not just the coronavirus. We have to keep our bodies strong and healthy.
I agree. And I think that's something, I see a lot of people talking about influenza, talking about sometimes not in the best way, saying that they're not taking coronavirus seriously because, hey, it's just the flu, right? But those are some of the same people who also don't get a flu shot. And so, yes, Dr. Olden is very correct in that we still have to be mindful of the flu. The flu is very dangerous, very deadly. There are people who are out there pointing out that so far this flu season, over 28,000 people have died in the United States alone from influenza. And keep in mind, influenza is something that we have a vaccine for, that we have a specific treatment for, and still people can die. So yes, go out there, get your vaccine, and stay healthy. That's true. We have a few other questions here. So one comment here from Sharon says, I have started turning off the television and listening to podcasts or reading. Today, I called 6 of my Facebook friends just to say, hi, I'm checking in. Really good, Sharon. What do you think about that, Dr. Olden?
I think, Sharon, I think that's fantastic. What better time to reconnect with folks that we haven't spoken to in a while? Another way of managing this whole social isolation that we're feeling. Call somebody up that you haven't spoken to in a while. Before this even happened, I set a New Year's resolution, or I guess a goal for myself, to write a letter, like a handwritten letter, to one of my friends every month this year.
Oh, I like that.
And it feels really good to connect with folks in a non, social media way.
Yes.
So I love the idea of calling, friends that we haven't spoken to in a while. Just hearing the voice of someone familiar is sometimes healing as well.
So Dr. Olden, I have a question for you because I like the idea of a handwritten note. How's your handwriting? Mine is so bad now. I don't know that I can handwrite a note to somebody.
Yeah. That is an exercise in mindfulness, is writing clearly. Yeah, it's hard.
I would like to write notes. Maybe I'll do cards. But I do like the idea of still receiving a card in the mail. I have some people who still send cards for the holidays. And it's actually nice to receive a paper card.
Think about how good that feels when you get it, right? And that's helping someone else feel better. It's making their day. And so, like, it makes both people feel really good.
It's true. It's true. Those are some of the simple things that we seem to have lost sight of. CC Earthly is saying, I live alone and not seeing people face to face for days is very stressful since I'm a people person. What can I do if I am self-isolated?
Mm-hmm. I think exactly what we've been talking about, connecting over the phone, writing letters, doing a FaceTime or, tuning into something educational like this, just filling up time with people that you can connect with. And it's about building connections, right?
Yes, yes. Michelle Miller, well, that's a blast from the past. Oh my goodness.
Hi, Michelle.
Hi, Michelle. Please, everyone, take care of yourselves and of each other during this time. I love the Dr. Duke and Dr. Olden collaboration. Yes. Hey, Michelle. Oh my gosh, I'm loving
Good
the
to
rock
see you.
showing out tonight. Sarah Lee says, thank you, Dr. Duke, for keeping us updated, and Dr. Olden for taking the time to share your knowledge with us. Really good coping mechanism. And then,
I want to say, Cindy, can I mention something else? I forgot that there's actually resources out there for folks who are maybe not able to access mental health services. Mm-hmm. So if you go on to, I think it's the CDC website, and you look up, mental health, coronavirus, there's a free number that you can call to connect with somebody. And there's also one that you can text. So if you need to, if you need a mental health provider, you need to just talk to somebody and no one's picking up the phone, and you're feeling like this is crisis mode, there are websites linked from the CDC that you can use to get some more assistance.
Absolutely. And as Dr. Olden said, we will share in the comments section of this live, once we've ended the broadcast, some of these resources that you can then go ahead to find. We'll be posting either as Dr. Cindy Duke or from Mindful Med ROC, his Facebook page. And if you haven't followed Dr. Olden yet, do please go ahead and follow his clinic as well as Instagram. And of course, Dr. Olden, I introduced the concept of telemedicine to many of our viewers on Sunday. And it turns out you also practice telemedicine, don't you?
Yeah, so I did home care for probably 4 or 5 years, and in my specialty, we were seeing patients in their homes without the modern technology that we were afforded in hospitals, right? So making calls and diagnoses and treatment decisions based on what we just saw in front of us.
Yes.
So that translates really well to being able to evaluate and speak to a patient in a medium like this, like a video medium. So I have set up on my website a way where you can connect with me and set up a call. Be just a short call, it could be a longer call, but that's a way that I'm sort of offering my services to folks who, maybe they just want to talk about their health, maybe they want to do a quick meditation, just putting it out there for folks who could use a little extra support.
Yes, and that's so important. Now, are you only seeing people who are from New York State, or can you see other people?
My understanding is right now just New York State. I'm not sure if you might know this, Cindy, if our licenses transfer outside of the state where we're licensed for telemedicine.
For telemedicine, you do end up needing a license in other states. But what's nice is there are a lot of what we call in-kind states, where if you have it's basically a reciprocal agreement that they have with your state, wherein if you're licensed in your state, they can quickly expedite your licensure in another state. And so it's called a compact now, and that's for telemedicine. And you can become licensed in over 20 states really quickly. You apply through one place, and then they get you licensure in a number of other states. And then, so I think that's also something that would be wonderful. Sonia Kuhar says, thanks, that was great. I remember Dr. Olden from U of R.
Oh, thanks for being here. Nice to see you.
Yes, hi Sonia. We have Kamaria saying hello from Tobago. Have you been to the Caribbean yet, Dr. Olden?
Oh my gosh. I don't know. Do the Cayman Islands count as the Caribbean?
They do.
Okay.
It's Caribbean, but it counts.
Yeah, that's a place I've always wanted to go, though. I hear it's beautiful.
I hear so too. I'm biased. One person says, nature, breathe freely now. And so he was doing the exercise and he enjoyed it. Lauren and Jerry, in response to a mindfulness exercise, she says a sense of calmness. So that was lovely. We had a few other people commenting about the mindfulness exercise. So let's get that, because it was a hit, it seems. So I'm really glad. One person says, Raina says, I could hear my own breathing.
Yeah. So, when is the last time that you felt so connected with your body, right? And think about what it feels to be anxious. It almost feels like you're disconnected from your body, like you have no control. And so that's what I really like about exercises like that, especially for people who have, anxiety or depression or stress, which I think is pretty much all of us.
Oh, yes, I agree.
Yeah.
A person here, she said, that was the same person. Sarah Lee says, thank you, needed that. So that's in response to the exercise. Another person says, needed that. And then another person says, thank you, felt really good, Dr. Olden.
Oh, wonderful. Well, thanks for joining us, Laura.
So, Dr. Olden, before we leave tonight, the one thing we didn't specifically connect was, how does mindfulness affect, and mindfulness exercises, acupuncture, yoga, what is the data in terms of their connection to someone with chronic disease like diabetes, hypertension, and how that helps someone who has that?
Mm-hmm. I guess it might be easiest if I tell a brief story from my practice. So when I started my holistic practice about a year ago, I had a patient come in with chronic cold sores. And as you know, cold sores being caused by the herpes virus are affected by stress. Someone gets stressed out, they erupt. They really start coming back. So I have been treating this person in my practice for almost a year now. And to be honest, as we go through life, things change and we talk more about work and stress levels and anxiety, and the acupuncture treatments have been really successful. I decided that I was going to be really conscious to check in with my folks a year in. So, once a year, let's make sure we do what we would usually do, right? Review medications. And has anything changed in your health? And I asked this person, we've been really focusing on stress and anxiety. How about your cold sores? I actually forgot to ask you the last couple of visits. And this individual actually, had a couple of tears in her eyes, and she says, I haven't had any cold sores in a year. Mm-hmm. And so I think it really just points to these types of exercises are really healing for our body, like from the inside out. Yes. And it shows that really by managing stress, we can prevent illness from not only appearing, but from getting worse. Yeah.
And I think that's important. Like I said on Saturday, I mentioned that I was a fan of the human body and the system, how it works. It's just everything about the system excites me because it's one of the most complex things ever designed. I mean, any animal system, but the human body is tremendous. And in terms of just how higher order thinking works, to how the system checks on itself, checks on the immune system, checks on the hormones. And you're right, because even how our system interacts with viruses, herpes virus, for example, is an interesting one because the virus, its DNA stays in the cell. And when you're stressed, then the that gets activated and suddenly you can have an outbreak of the virus because it's always been there living in the cell, as we call it. Or since some of the Dewhurst lab crew here, it's episomal. It stays within the cell living. And so the code for it stays in the cell always. And so you're right, because that change in the immune system, change in stress, whether it's another chronic illness or stress at work or panic mode, an anxiety attack can also lead to an outbreak, for example, of that viral infection, herpes. So very true, very true. And so the other question that we have here is, Kathy was saying, I don't know if they can see mine. Well, Kathy, we did see it. Thank you so much. I encourage you, Kathy, to join us again tomorrow for when we have Dr. White joining us to talk about pediatrics, in particular children, and coping with all of this during coronavirus. Well, Dr. Olden, thank you so much for joining us today. Tell everyone, how can they find you? So you're on Instagram, you mentioned, but is there a website? If someone's in New York State, for example, and would like to get in touch with you, what do they do?
Yeah, I think the two best ways. First of all, Cindy, thank you for having me. I'm glad that we've been able to just release some of the stress and prepare you for your evening, and our viewers as well. Thanks for being here. The two best ways to connect with me would be on Instagram, mindfulmedrock, which Cindy put up here, and then I do have a website, mindfulmed.com. Both of those ways are probably the best ways to get a hold of me. I'm pretty responsive over email, but look forward to connecting with everybody.
Yes. And do you have any parting thoughts or words for the audience before we depart tonight?
We will get through this together.
Yes. And that's important. That's so important, guys. And as you can see, doctors across the country are using their expertise to figure out ways to help patients. We also are very diverse in how we practice, diverse in how we've integrated different aspects of our healthcare to help patients. And so I wanted to highlight Dr. Olden tonight because I think what he's doing is amazing. And that's not just because I know him, but because I truly believe in this integration and the holistic approach to patient and patient care. And all diseases, really, I think there's a holistic approach to all of it. So thank you so much, Dr. Olden. To everyone watching, keep sending your questions. Thanks for all the shares. Keep sharing, and we'll see you tomorrow.
Good night.